Hello and welcome once again to our online fertility awareness program, You and Your Fertility. My name is Dr. Uju Eze and I'm your host. We are still on the fertility diet edition and this is episode 5. If this is your first time joining us, please hit that subscribe button right now. This program is proudly brought to you by Love Foundation. Love Foundation is an NGO located in Rivers State, Nigeria, and is an organization that is focused on fertility and reproductive health awareness, education, and support. This we do via our various programs. We have our fertility counseling programs for couples who are trying to conceive or trying to grow their family. We have our fertility and reproductive health awareness programs. This is one of them. We have various educational content across all our social media handles and on our website. You can just jump into any of them and learn all you need to know about fertility and reproductive health. On Facebook, we are on at Love Foundation. On Instagram, we are there as Love Foundation as well, and the handle is love_foundation_. On YouTube, we are also there as Love Foundation. The handle is love_foundation. We have a support group on WhatsApp. So if you want to be part of that group, you click on the link in the post following this video. Welcome back. So like you know, we have been having series of topics pertaining to fertility diet, and we have been taking various fertility related situations and talking about what foods can best help to manage such situations. We've talked about polycystic ovarian syndrome, we've talked about improving egg and sperm quality, we've talked about the fertility journey in general, and we've also talked about foods that help in the regulation of hormonal balance. So today, like I said, we are at episode 5. Today we are talking about the endometriosis diet. Welcome to the month of March, and as you must know by now, March is Endometriosis Awareness Month. And so the first video we want to do this month, we want to dedicate it to talking about the endometriosis diet. Endometriosis, like we might already know, is a chronic, non-cancerous condition that involves the growth or proliferation of endometrial tissues outside the womb. Simply put, you have the tissue lining the inside of the womb, which is called endometrial tissue, growing in other places outside of the womb. This is what the condition of endometriosis is all about. Endometriosis is a very painful condition. The characteristics of endometriosis is severe pain, and the area it affects the most is usually the pelvic region. So that pelvic floor where you have the uterus. The endometrial tissues usually grows around the ovaries, fallopian tubes, and then the pelvic floor proper. So anytime around the menstrual period, these other tissues begin to cramp and bloat and have inflammatory changes, causing severe pain in the person that is suffering from that condition. The symptoms of endometriosis, like we have already mentioned, severe pain, but others include extremely painful menses, which you call severe dysmenorrhea. There's also dyspareunia, which is pain during intercourse. Then we have bloating. Some people can even go as far as having diarrhea. We have people who have low back pain. We have people who have leg pain. In some very rare cases, you have abdominal and even chest pain in some people. We have people that suffer from constipation. Then we have those that have severe pain anytime they want to move bowel or even urinate. So anything that involves the movement of the bladder and the bowels will cause severe pain for them. Urination, normal going to toilet will cause severe pain, and that is why some of them end up having constipation, because they fear going to the toilet to ease themselves, and as a result there is backlog of waste matter resulting in chronic constipation. There is also intermenstrual bleeds, that is bleeding in between periods, after one period, before the next one, light bleeding happens before the main next period happens. That's another thing that can happen with endometriosis. And then some people have the one we call menorrhagia, where there is excessive bleeding that can last up to 7 to 10 days, in some cases 2 weeks or even more. These are all symptoms of endometriosis. Unfortunately, endometriosis has no cure, and if it is not properly managed, it can lead to infertility, and that is why we are so interested in this particular topic. The continuous scarring and inflammatory processes that happen with every endometrial painful episode, with every cycle, it worsens the situation and then can leave inflamed organs, inflamed tissues, the ovary, the uterus itself, making it difficult for it to conceive and harbor pregnancy. The treatment of endometriosis is basically pain management, being able to have a pain plan so that whenever it comes, you know what you're taking, the cocktail that works for you, for the individual, and then you manage pain. But it has been known that improving lifestyle can also help in abating the symptoms and reducing the outcome, the negative outcome or impact of infertility, of endometriosis on the system, which one of it is infertility. So what we want to focus on today are those lifestyle practices that can help in the management of endometriosis. The lifestyle practices are just basically managing diets and then practicing exercises. There are specific exercises that help with endometriosis, pelvic floor exercises in particular, and that really helps in relieving the symptoms. But our focus for the purpose of this episode today is the diet. So what are we looking at when we talk about endometriosis that people should eat? We also want to look at what should people avoid eating, these things that are the things that might exacerbate the symptoms and the effects on the system. And then what food should they eat that will actually help them to improve the symptoms or abate the symptoms and their outcomes in the body. That's what we'll be looking at. Don't go anywhere. So we want to start with the foods that negatively impact or worsen the effects or symptoms of endometriosis. First on the list is gluten. We don't just like this gluten when it comes to fertility health. So gluten producing foods are also severe culprits when it comes to exacerbating the symptoms of endometriosis. We already know our gluten containing foods made from barley, foods made from wheat, foods made from rye or malt, however you choose to call it. But these three foods are gluten producing foods, and everything that is derived from them should be avoided by people who have endometriosis. So we are talking about everything with flour, our pastries, our breads, white bread, unfortunately, snacks, most of them, all those things, our noodles, pasta that are from refined flour, those will produce gluten, which will worsen the symptoms of endometriosis in the body. Number 2 on the list is trans fat. Again, trans fat is one of the foods we did not approve of or encourage for general fertility in health as a whole. So also here for endometriosis, it is implicated as something that worsens the symptoms of endometriosis. Trans fat, we have already explained, is unsaturated fatty acids, and these have a lot of inflammatory properties that they produce in the body. And of course, we know that endometriosis is all about inflammation and pain, so eating these foods will further worsen the endometriosis that somebody might be suffering. Then we want to look at red meat. Red meat also, because of the high cholesterol content and all of that, also impacting on increasing inflammatory processes in the system, further worsening the endometriosis that is already in existence. Finally, we are looking at highly fermented polysaccharides or starch. This highly fermented starch can also bring about exacerbation of the symptoms of endometriosis. We have foods that influence hormones. So you're looking at our alcohol, we are looking at coffee, and all these other foods I have mentioned. As long as they are influencing hormones, especially estrogen, they can worsen the symptoms of endometriosis in the body. So what are the foods that help fight against endometriosis in the body? What foods can we eat that will help us battle endometriosis in our system? Number one on the list is high fiber producing foods. So we are talking about your vegetables, you're talking about your fruits, you're talking about your whole grains. These ones that are very rich in fiber. They will reduce inflammation, reduce glycemic index, like what we talked about for PCOS diet, and these will generally reduce the impact of endometriosis in the system. Second on our list is iron-rich foods. Iron-rich foods, here we are looking at our dark green vegetables, we're looking at broccoli, looking at our whole grains again, our nuts, and our seeds. Flax seed again, you know, we've talked about flax seed and hormones, and as long as we are regulating hormones, it will also help with endometriosis. So our flax seed, our pumpkin seeds, our green leafy vegetables, our fruits, these are high iron containing foods, whole grains, and they can help us combat or battle endometriosis. Third on the list are foods rich in omega-3 fatty acids. Again, we are repeating ourselves. Omega-3 fatty acids cuts across improving fertility health all through. So you want to focus on your salmon, on your sardines, then simple things like our walnuts, you know, our flax seed again, our chia seeds again. These are very rich in omega-3 fatty acids. Your avocado, very rich in omega-3 fatty acids, and they will help to reduce these inflammatory processes that worsens endometriosis. So consuming more of these foods will help you manage endometriosis, improve the symptoms, that is, reduce the frequency and intensity of the pain that comes with endometriosis, and helps you have a better outcome from the condition as well. Remember, we have said this condition is chronic, it has no cure, it's something that somebody will manage for life, and if not managed properly can cause infertility. So all these foods we are talking about can help in their management, can help control this condition in the system, and then reduce the inflammatory processes that can later cause damages on the tissues that are involved in our reproductive health. Last on the list are foods rich in antioxidants. We've talked about antioxidants before when talking about improving fertility health. We talked about it when we were talking about improving egg and sperm quality. We are repeating it here again. So foods rich in antioxidants are always beneficial for the reproductive system. Here it helps in managing endometriosis as well, and we're talking about our oranges, talking about our beetroot, we're talking about spinach, we are looking at dark chocolates. Yes, we have said that before. So dark chocolate, this is one of the things that is also rich in antioxidants and will help in the management of endometriosis. So these are the 4 classes of food for endometriosis: fiber-rich diet, iron-rich diet, foods rich in omega-3 fatty acids, and foods rich in antioxidants. If you can invest more in these foods, focus more on them, you find out that you are having a reduction in intensity of symptoms, reduction in their frequency, you're able to manage them better. Those severe chronic crazy pains that come with menstruation can be managed better, and their impact, their effect, because it's not just about the pain but the effect it has on the reproductive system, you know, over time, the effect will also be reduced just by focusing on this kind of foods, and also practicing other lifestyle practices like exercising, of course, sleeping properly, and most importantly, avoiding the things that will worsen endometriosis. This is where we will be stopping for today. We hope you learned something. Remember, our logo is Learn to Teach Others. Until we come your way again next week, stay blessed.